For those of you who for those of you who don't know me, my name is Elizabeth Bostic, and longtime friend of the Federation for Children with Special Needs, and I'd love to welcome you to this evening's Connecting Families, where we're going to be talking about the Caregiver to Caregiver Respite Network, a program that is near and dear to my heart. But before we get started, just wanted to let people know that if you are in need of any kind of interpretation, we do have an app for that called Wordly, and there will be information put into the chat so that you can actually select that and get your language of choice. Um, so, and this will be recorded, of course. So if you're, those of you who may not be able to stay for the entire time, or if you have questions that you won't be able to stay to listen to the answers for, we will be uploading this recording to the Federation's website along with slides. And any questions that we weren't able to answer, we will make sure that we answer those as well and include them with the upload. So again, if you are in need of interpretation services, please take a look in the chat and you will find the link to Wordly. We are incredibly excited to be able to share with you the new program, one of the new programs at the Federation for Children with Special Needs, which is the Caregiver to Caregiver Respite Network. And I am thrilled to be joined with its program director, the amazing Valeryia Pedersen, who has been doing a phenomenal job of getting this program up and running. So welcome, Val. So good to see you again.
Thanks, Beth.
Yeah. So Val and I are partners in crime around this program. And so what we wanted to do tonight was introduce it to you and then answer any questions that you might have around it. So we invite you to use the chat to insert any questions you might have along the way, but you may find that in listening to the presentation that just about everything that you may have for questions will be answered. So we're going to ask that you hold them, as many of them as you can, till the end of the presentation, but our partners at the Federation will let us know if there is a question that is relevant to a slide that we are presenting so that we can make sure we're answering things as they come up. All right. So the Caregiver to Caregiver Respite Network is actually a program that was born out of my own experience as a caregiver of King James, my son who was medically complex. And so we're going to give you an understanding of what this program is, how it's evolved, and the amazing work that it's been doing in our community. And some of this will also, in terms of background, help you to understand, like, what is this thing called respite? Why do we not seem to have the kind of respite supports that our families need? How is that impacting our families and others? And then the solution that I propose that has now become a reality that we're so excited about, and then help you to understand, how does this program actually work and how can you actually participate in it? Next slide, please. So I'd like to introduce you to the amazing, the wonderful King James. King James was my son. When he was born a healthy newborn, and 10 days afterwards, because of severe jaundice, he became severely disabled. And so what that meant for him was that he was nonverbal, non-ambulatory, G-tube fed, hearing impaired. He literally had no or very little volitional movement. And as is typical of many children who are medically complex, he had multiple surgeries over the years. And he was a child that required maximum assistance for all activities of daily living. He quite literally was my life. He turned my life upside down. He was a joy, a source of joy, a source of pride. And at the same time, he was also a lot of work, right? And so, as we know, our kids have a way of being two sides of the same coin in that way. Can you go to the next slide, please? So the irony of having James was that when I was a child, I wanted to be a pediatrician because I loved my pediatrician and I thought I would be able to wear a super cool white lab coat with my name embroidered on it. And then I discovered that bodily fluids were involved. And so I decided, maybe I'll become a teacher or a trainer instead. But the irony was is that once I had James, the doctor role kind of resurfaced again, the need to actually be able to coordinate so many different things for James. And all of us are familiar with this, whether you have a child who is medically complex, a child who is neurodivergent, a child with intellectual disability, and everything else in between. We know that our kids have a tendency to require a lot of additional supports. And so we as caregivers take on lots of different roles, right? We become therapists, some of us behavioral therapists, physical therapists, occupational therapists. We're managing supplies or equipment. We're always managing the other aspects of their team, which would be educational, recreational, social, all of those things. Some of us become pharmacists, right? We're the emergency medical transport provider, the nurse, the case coordinator. We do all kinds of things all the time, right? So we go from being a parent of an amazing kid to also having all of these other roles to manage their lives so that they can have the quality of life that everybody else can take more so for granted. Next slide. So, one of the things that I was thinking about was that as I was going through my own education, getting my executive MBA at Suffolk, I wanted to know more about why it was that the kind of respite support that I needed as I was taking care of my son was not available. And so as I was doing the research, it was amazing to see some statistics that really were a reflection of my own experience. Things like 60% of caregivers of children with special health needs report a burden of care, which I really hate that phrase because James was never a burden. And I'm sure all of you don't feel as though your children are burdens, but that is the term that's out there. In other words, we have a much higher propensity of burnout because of the number of things that we need to be doing day in, day out with no kind of break, right? Over 60% of moms in particular either have to change the way that they work or stop working entirely in order to be able to manage the needs of their children. 80% of people who are employed report that having to be a caregiver of a child with special health needs actually impacts their productivity at work, right? And this didn't matter what type of disability the child had. It was a universal issue that all of these things, all of the different things that require to take care of our kids really did impact us. And so I began to wonder, well, how do we solve this problem? Because if we're not able to be as productive, if we're not able to do the things that we normally would do, how do we actually maintain the kind of financial stability that our families need, our mental health, and a number of other things are just our quality of life that we would like to have that shouldn't just disappear because we have a child whose needs may be more significant than others. Next slide. So I've been using this term children and youth with special health needs, and I want to make sure that we were all kind of on the same page as what that means. And it basically is any child that has chronic conditions that are either physical, developmental, behavioral, and or emotional, right? And we estimate that there's somewhere between 300 and 340,000 of those kids here in the state of Massachusetts. It's about 1 in 4 homes. And 11,000 of those fall into a smaller category, which are the kids of medical complexity. And that was the category that James was in. And that basically meant that this was a child that had very, very substantial service needs. There were multiple chronic conditions, so more than one system in their bodies were being impacted. Their functional limitations were extremely high and often tech dependent. And then also the healthcare use, even though they only represent between 1 and 3% of all children in our state, they actually represent the highest percentage of healthcare cost compared to other children. The thing that was also striking as I was looking at this particular population of children is that the caregivers of children with special health needs in the state of Massachusetts provide at least 4.1 billion, that's billion with a B, dollars of uncompensated skilled care every single year. That is a staggering number, right? And so I want you to hold on to the term skilled because that's going to be an important part of the solution that I propose and that this federation is now implementing. Next slide, please. So here's the problem, and I'm sure anybody here, on some levels, I'm preaching to the choir. Massachusetts lacks a comprehensive and accessible respite service for our kids and our families. And it's actually impacting not only our families, but employers. It's impacting them in terms of loss of productivity, loss of institutional knowledge for those who may be leaving organizations, and employee turnover. And so I wanted to know why. And some of the reasons that I found, I'm sure will not sound as surprises to you, right? Siloed bureaucracy, for example, we know that if we go from one agency to another, eligibility in those agencies and services will be completely different, right? There is a lot of inconsistency and they don't always talk well or play well together, right? We have a workforce crisis. And so our direct service providers, whether they be PCAs, nurses, respite providers, home health aides, we do not have enough people to actually do that work. And then when we do have these services available, they're not necessarily available at a time that works for us. Transportation may be an issue in terms of being able to get to those services. They can be cost prohibitive, right? And some of you may have even experienced this as well. We may have respite services out there, but we don't know where the heck to find them, right? It's not something that's easily discoverable. Next slide, please. So I started to study, well, what is the real impact from a financial standpoint? Because all of us know that the way to really convince people to move things is often the bottom line, right? Is the dollar. So for families, we see lower productivity in work, forced change in employment, and this is impacting people's employability. And we're estimating that that's costing about $31 billion of lost income nationally for families, right? So think about the financial impact that that's having on families. And many of you, I'm sure you don't even have to imagine that, you've been experiencing it. For employers, that means we're talking about 25 billion, and it's actually probably closer to 31 if memory serves me correctly, because the numbers have since gone up, of lost productivity nationally, right? So locally, we're seeing turnover, absenteeism, presenteeism. It's costing Massachusetts employers at least $573 million a year. And that was as of 2020-21. So it's probably even higher now. And for the state, here's the irony. We lose talent due to caregiving responsibilities. So as a result, people are no longer employed. If they're no longer employed, there's a loss of income. If there's a loss of income, there's a loss of tax revenue. This is a huge problem because our tax revenue is often what is funding our services. So now we've created a dilemma because we can't actually increase tax revenue if people aren't actually working, right? And so now we have a real dilemma that is really impacting the entire state, not just this small group of families. Next slide, please. So as I started thinking about this, I came up with this idea of called the Caregiver to Caregiver Respite Network. And as you can see here, James and I are incredibly excited to share with you this amazing solution. The reason that this came up for me was that as I started thinking about all of these numbers that I just shared with you, it occurred to me that in the times when I needed someone to take care of James and I didn't have my usual PCAs or anything like that, the people I tended to rely on were other caregivers who had children with similar support needs. So I could call one of my friends who also had a child in a wheelchair who was G tube fed and who needed to be transferred from their wheelchair to another surface. And they knew exactly what to do. I would just have to tell them, make sure you feed them at this time. Here's the formula that they need. Here's the medication. You're good to go. You know what to do, right? And so what I wondered is, why couldn't we create a network just like that for everybody else? What if we were to match up families based on language needs, geographical needs, and also support needs of their child so that they could actually support each other? Because the one group of people that hasn't been considered when we think about a skilled workforce are the caregivers who do this every single day. Next slide, please. So we actually patterned this after another existing program that we have here in the United States called the Parent to Parent Network. And basically, it's a program that was started by a social worker back in 1972 who really understood that the best way for parents to actually get the information that they need is to have the lived experience of another parent to be able to share that with them. And so they created this network. And of course, we have that here in Massachusetts. It's our Family Ties program where we really actually match parents up to help to be able to support each other based on the experiences they've had and the fact that they know exactly where to go to get certain things and how to do that. So what we're actually doing is tapping into a fully trained workforce by matching caregivers with other caregivers with children who have similar needs so that they can provide respite for each other. We're also taking into consideration that for compensation, there's a number of ways you can actually do this. You can actually do the old-fashioned private pay. You can leverage even your DDS flexible spending dollars if you have access to those. You can leverage unused PCA hours. And then the other thing that was really important to me, especially for families who may not have eligibility for programs or who may not be able to fund things, to be able to barter, right? To be able to actually exchange 4 hours for 4 hours or 8 hours for 8 hours, which we call in kind exchange. One of the things that I love about this program is that it mimics the PCA model. In other words, it is completely driven by the caregivers themselves. They decide how to do it. It's directed by their family's needs, and together they figure out how to manage the needs of each other's families. And it's low cost. When I was doing this at the time, we were looking at creating just a registry and some family engagement specialists. And relatively speaking, when you look at a program like that, it was not costly. So this became my capstone and what I actually presented to get my executive MBA. Next slide, please. Serendipitously, soon after I presented this, uh, about $20 million came into the state of Massachusetts through their Respite Innovations grant program. And what they were looking for was for people to be able to propose and to try out innovative ways to provide respite for anybody across the state of Massachusetts. One of the things that was really cool about this was that there was no penalization if, in fact, the program didn't work. The whole point of this was to try something new, get some data to help us to understand if it works, why, if it doesn't work, why, and then be able to use that so that we can look at ways that we can expand respite within the state of Massachusetts. 42 organizations received awards, and they ranged from $40,000 to $1.2 million. The Federation was awarded $1.2 million to actually implement the Caregiver to Caregiver Respite Network. And so as a result, the Caregiver to Caregiver Respite was born. So I am now going to transfer this over to my partner in crime, Valeryia Pedersen, to help you to understand how the Federation has implemented the program.
Thank you so much, Beth. So, as you see on your screen, the program is fully alive and thriving at this point. We are almost at a 1 year anniversary, which seems incredible, but next month it will be 1 year since we launched. And if you haven't seen our website yet, I encourage you to grab your phone or mobile device and scan the QR code that you see on your screen at this moment. You can browse our webpage. You can watch some of the amazing videos that Beth has recorded for us, and we have recorded as a program to give you more details and an overview of the match process. So there's a lot of different resources on our webpage, including some frequently asked questions that you can get answers to. I will talk a little bit more now about the current participation considerations, and it is one of the first questions that we usually get asked. So right now, we are focusing on Massachusetts residents, and we are serving primary caregivers of a child or youth with disabilities and or specialized support needs. And the youth or child have to be within the age range of 0 to 26 years old. And we also ask caregivers that they be willing to receive and or provide respite care. So some of our caregivers are open to both receiving and providing. Some only want to receive at the moment, and others reach out as they have a little bit more time on their hands and offer to support another family and provide respite. Now we'll talk a little bit about how the program works. There are a number of match criteria that we go by. So first and foremost, we look at the child's medical and support needs. We want to give our caregivers the comfort of knowing that whoever they're matched with, they are already aware of how to support a child with autism or complex medical needs, or somebody who might need a seizure protocol. So we really try to match our caregivers based on what their child's needs are, whether they're medical or behavioral or emotional, and that's our starting point. We also look at where our families are located. We want to make sure that our families don't have to drive more than 30 minutes to their matched caregiver. So that's kind of like our guiding distance for families to be matched. And then we also ask families their preferences around cultural and linguistic identities. So some of our families speak a language other than English, and so we want to make sure they also have access to the program in a meaningful way. And I will go into detail a little bit more in the later slides about our languages. So you will get a little bit more information about what they are. So for C2C staff, what we provide is first and foremost, we help our families with the background checks. That's one last thing on your to-do list, right? If you are familiar with the PCA program, that's usually something that you have to do as a caregiver, where in C2C, we take care of that for you. We also provide a robust online learning platform that was curated with all sorts of different resources. We've recorded some videos to go over culturally and linguistically responsive respite practices. We share videos about disability rights, about fire safety protocols, right? If you're in someone else's home or somebody is in your home, you definitely want them to know what those protocols are. So we really try to gather some information that would be beneficial to our caregivers to access. And so each caregiver receives a link that is personalized to the learning platform where they can participate in the discussion board, access our content, and really enjoy that added bonus of participation in C2C. We also provide an orientation session when caregivers first submit a match request and go through the different first steps of participation. We invite them to come to our orientation session so that they can get more familiar with what the program is, what the match steps are, what are the best practices in searching for the right caregiver, or how to identify a good respite provider for their child. So there's a lot of different things that we describe in this orientation session, which also includes creative ideas on how to receive and provide respite. A lot of times we picture respite as a service that only a professional can provide, and they come to our home and they basically take care of our child for 6 hours. The C2C staff will debunk that notion during the orientation. So if you're curious to get some more creative outside of the box ideas on what respite might look like, you should definitely join one of our orientation sessions. And of course, we also provide bilingual support. We have access to ASL interpretation when needed. We really do try to make sure there's language access across all different aspects of the program. One of the keys to the success of the program is reciprocity. And so, what we really mean by that is when you can provide a service and also receive a service in exchange. There are a number of benefits to that, including providing confidence and care because you know that somebody has been in your situation. They have very similar lived experience and skill set. You also build and foster a community. A lot of times we hear our caregivers describe their situation as living on an island, and we certainly don't want anyone to feel that way. And so the whole purpose of this program is to help a caregiver combat isolation, build their community, create wonderful social connections, and not just for yourself, but also for your child or children, and even for the whole family. So I have a delightful video to share with all of you so you can see how this program actually works in real life. And when I say you can build social connections for the whole family, you will see exactly that in this video.
Mark and I, right after we got married, knew, we were a little bit older that we were going to have kids. We really wanted to have two kids. And so when Lucas was born, 5 weeks later, we found out he actually had congenital glaucoma, which kind of took us through a completely different journey of our lives as parents.
Johnny was born with a rare metabolic disease called PKU. He was diagnosed through the Massachusetts Newborn Screening Program at 5 days old. And hearing their story, it could be ours. I found that other parents in similar situations are the best source of knowledge. And so I was looking to connect with other parents in similar situations.
C2C matches caregivers with one another based on their children's medical and support needs. Then, the families can work together to provide one another with breaks from caregiving.
I was matched with somebody in my town who I did not realize was in the same town as me, going through the same thing as me, and now, we've really become really close.
I don't feel alone anymore. I think Jen and I talk every day throughout the day. We have in common that it's not just our kids, it's all kids. The Federation helps parents find their voices, find their community, find the people that help us feel like we can use our voices for our kids. And hopefully the legacy is like one day our children can self-advocate in whatever way they communicate.
So I hope you all enjoyed that video. That was one of our very first matched caregiver pair. And, we really appreciate them sharing their perspective. And I think a lot of us can see ourselves in that video. So we'll go over the program process steps. The very first step that one would take if they would like to access C2C services would be to request a match through our website. If you go to fcsn.org/C2C, you will be able to find our match request application right on the website. There are a number of things that we ask there, including references. So that is not a professional reference that we're asking. We're asking for somebody who knows you as a caregiver. It could be a neighbor, a friend. It could even be your child's pediatrician. So somebody who could speak to your caregiving abilities. After the match request has been submitted, we will send a text message to each caregiver asking them to schedule an intake call with us. And the call usually lasts about 30 minutes. It's a virtual call. Of course, there's an option to do it over the phone if somebody would prefer, but typically we like to put a face to the name. So we do love to do our calls virtually. There are some additional questions that we ask that are not covered in the match request application and mainly include, the home setting and things like allergies or the child's preferences and some other details that would be helpful for us and helpful for the caregiver that you would get matched with. We also start going through the query and SORI process. We have a query form that we share with each of our caregivers, and the information that gets entered on the query actually is what drives the SORI check as well. And for someone who's not familiar with those acronyms, query stands for Criminal Offender Record Information, and SORI stands for Sexual Offender Record Information. So these are just the background checks. We do also like to know to a lot of our participants are, asking questions like, would this be somehow related to my immigration status, which we always answer, no, it has no bearing on the immigration status or any other information other than criminal or sexual offenses. So then we contact the references and we just send them a very quick survey that they can fill out and leave us a couple comments about, the caregiving abilities of the parent who's requesting the match. We also invite our caregivers to attend the orientation session that I had mentioned earlier in the presentation. And then we also send out an invitation to our learning platform so caregivers can start engaging with us and maybe posting to the discussion board, accessing the content that is on our learning platform. It also includes some really essential forms like an emergency form that caregivers can download directly from the learning platform. And I think it's really helpful when you have somebody else take care of your child that you gather the information that is really critical and essential for your child, like their medical providers, their allergies, any kind of seizure protocols or medications or anything like that. So we provide a form where you can do that and share that with another caregiver. We do offer CPR first aid certification. Currently, it is optional. We do ask that question, and we actually have a trainer on our staff. So that is something that we will definitely plan to offer to all of our caregivers in the future as well. However, if somebody decides to access a training in their community or already has a certification, we currently offer a reimbursement in the amount of $25 towards that certification. So all you would need to do is send us a copy of your certification card. And so once those steps are completed, we start the match search. Our coordinators are very hard at work. We have a really beautiful map in our database where we can see where our caregivers live and really see what their children's support needs are and find the best possible match for them. And once we do, we schedule another virtual call where we invite both caregivers who are getting matched and we have them introduce one another or introduce themselves to one another and, discuss different topics and really ask questions and kind of decide for themselves if they want to meet in real life, if they want to be matched, which we ask post the introduction call. We will ask if they want to exchange contact information. And once they do, we give them the freedom to set up however they want this match to work. So it could be where caregivers first meet for coffee one-on-one, and get to know each other better. Sometimes caregivers want to meet with their children, so they might go to a library or they might go and have a play date at one of their homes. The possibilities are really endless, and it is important to build that comfort prior to having somebody take care of your child. So we do understand that there's a number of scenarios that these matches can go, and we give our caregivers the creative freedom to follow those scenarios in the best way that makes sense to them. A little bit about our compensation options. So as Beth has already mentioned some of them, we do offer 3 types of compensation options currently. The one that we talk the most about is in-kind exchange. This option gives the most accessibility for all families to this service, as we know financials can be sometimes hard for families, especially families like ours, where we already have so many therapies and so many other services that we're paying for, sometimes out of pocket. And so in-kind exchange is exactly what it sounds like. You are exchanging services, you are receiving services. The number of hours where you receive and provide the service is the same. So, there really is a benefit that comes out of that exchange, including not having to spend additional money and worry about the financial aspect of that service. Of course, private pay is available for those who have, the funds to pay for a caregiver. That is definitely an option. And then for private pay, as Beth has also mentioned, you can use your flexible spending dollars through DDS. We always bring that up to families, as sometimes that's not the first thing we think of, but that is an option. The personal care attendant hours is a program offered through Mass Health. Some of our families already have access to Mass Health, and they might have already received their evaluation for PCA or personal care attendant. And for those who have not, we do offer support in finding more information about PCA, or even when families need some support applying for Mass Health. The Federation actually has two staff members currently who are certified application counselors with Mass Health, and they're available by appointment. So we're happy to connect our families and help them schedule an appointment so that they can access Mass Health and then access the PCA program. This is our team. It has changed a little bit over time, but the languages basically stayed the same. As I've mentioned earlier, we do have multiple languages represented in our program. Our coordinators speak Spanish, Portuguese, Vietnamese, Haitian Creole, Korean, and Chinese. We are a fully multilingual, multicultural team. And this is our contact information. I'm going to pause for a few seconds on this slide if any of you wanted to take a screenshot. I will also send a PDF of this presentation, so you will get the contact information for our staff. If there's one of us in particular that you would like to reach out to, our primary languages are indicated there as well, and you can contact a staff member in their primary language. Some of the activities that our program engaged in prior to the launch to make sure that we are very intentional about those culturally and linguistically responsive services are things like creating focus groups, for instance. So we really wanted to hear from the community what the needs are for respite, and not only what the needs are, but also what are the best ways that we can support those needs or meet those needs. Accessibility of materials and trainings was a very important aspect of this program that we consistently think about. You know, how do we provide our materials, our written materials, our video materials? Do we have access for all of the languages that are included in this program? And also sharing information about C2C through all of the established partnerships that the Federation has with all of our multilingual communities was a really important factor for this program. And when I talked a little bit about the focus groups, some of the data or some of the feedback that we received from focus groups, I will share in the following slides. They helped a lot in terms of how the program was organized. So as you can see, some of the questions that we asked our participants were such as, what are your primary concerns around participating in the matches? And a lot of the answers that we received sort of came down to these categories that you now see on your screen, and that's what helped drive the program accessibility. So for instance, when our caregivers mentioned that the well-being and safety of the child was one of the concerns, we have been supporting it with our background check system. So we make sure that the trust gets established right away, and we're able to vet everybody who comes into our program through the background check. You know, the training of caregivers was a concern for our families, and therefore we offered the learning platform to support our caregivers with information, with resources, some training opportunities. You know, that's also why we pursued the CPR certification and first aid training that we can offer to our caregivers as well. Other concerns were, you know, language and communication, and we do ask all of our families what their language preferences are. Some of our caregivers who do not speak English currently and indicate that they would like to be matched with somebody who speaks their primary language are able to access that support because of the intentionality with which we have approached the building and the design of this program. Some of the other questions were around the barriers that families see around finding respite services. And of course, not surprisingly, a lot of them were around availability or, you know, the number of programs that are currently in the area where families reside. Financial constraints are a barrier, transportation, and you will see all of these concerns reflected in how the program addresses the different aspects of matching. So, for instance, when we talk about transportation being a barrier, that's why we make sure our caregivers are located within 30-mile driving distance. And, you know, if they don't have access to a vehicle, we can find other alternative ways how they can still access respite and can, you know, access the other caregiver that they would be matched with. Financial constraints, again, that is why the in-kind exchange option exists for compensation, so that it would not be presented as a barrier. And many of these other insights that we received from families were very helpful in the process of building this program. This is a snapshot of the landing page for our learning platform. As you can see, we have a number of different resources available. We have videos about the origin of the Caregiver to Caregiver Respite Network with Beth. We have introduction and overview of the program, similar to what you are attending right now, but you know, a recorded video. And then we have our culturally responsive respite practices, which is a series of videos that we recorded. And we talk about how disability is perceived across cultures, how respite is perceived across cultures. We also explain the compensation options in more detail so our caregivers could really understand the differences between the different options. And we go over a little bit of the CPR and first aid skills. It's not a full training on the learning platform. That would have to be accessed in person with our certified trainer, but we do give the basics. As I had mentioned, fire safety, disability rights, all of that content currently lives on our learning platform and is available as a bonus to the caregivers who are registered with our program. A little bit of the program data. As we know, data tells a story, and I can see that that story is a little bit incomplete. I'm not sure why, but a lot of the percentages are not showing up on this slide, even though they did in my PowerPoint. So I'll do my best to just describe them. As you can see, 63% of the match requests are currently in English, but the rest are in other languages. So we have about 10% of Spanish match requests. We have about 11% match requests in Chinese. We have probably around 5% in Haitian Creole and respectively in Portuguese as well, and some in other languages. And I apologize for this slide. I'm not sure what happened, but that's kind of frustrating just to see a blank pie chart. Just for numbers, again, we currently have around 150 match requests, and we have about 36 caregivers who have been matched and are already enjoying respite services. And that brings me to the last slide of our presentation. I will pass it back to Beth.
Thanks so much, Val. So as you can tell, Val and I are really excited about this program, and there are a number of reasons why we're excited about it. This is the Caregiver to Caregiver Respite Network that accomplishes so much. We're able to access an untapped skilled workforce, a group of people who do this day in and day out, have never been compensated for it, and now have the opportunity to support each other. It is a really low cost program, relatively speaking, and as a result, the rate of return is actually extremely high. When I was calculating the rate of return on this, it was literally over 300%. Who wouldn't want to participate in a program with that kind of return on investment? It addresses a serious unmet need, right? We all know all of us are tired. All of us really need a break. even half an hour would be really nice, right? If we can have 4 hours, 8 hours, just the opportunity to just take a breath, to have our mental health needs be addressed. And the other thing that's been super exciting is it really has the potential for national utilization. We're already getting other states who are interested in replicating this. And why is that so exciting? Because one of the things that I imagine could happen one day is that someone from Massachusetts could go to Florida on vacation. And if you're like me, I used to feel like vacations were really more like relocations. You don't get to do a heck of a lot more differently. You just get a change of scenery. But in this program, if you could actually be able to tap into a C2C in Florida, be matched up with a family there, you could actually, as a caregiver, have someone that you would be able to take care of your child for you for an agreed upon period of time, and you can go off and do whatever the heck you want to do. You could walk on the beach. You could read a book. You could spend time with your loved one. You could get as far away from your loved one as you want to. There are so many possibilities. And what we're also learning is that while we focus primarily on children and youth with special health needs, and right now under the age of 26, really this could be replicated for all people who have caregiving needs. So there's lots of potential for growth here. And so Val and I often say, today, Massachusetts, tomorrow, US, next year, the world. Why not? So we're really excited about the possibility of doing this. This is a way to honor King James and his legacy. And we're really hoping that this is something that you will take advantage of so that you will have that much needed break as soon as possible. So with that, we have a little bit more time for some questions, and then afterwards we will talk about some upcoming events that are happening at the Federation.
And I was thinking that just before I exit out of this slideshow, I'm just going to advance to one last slide that I have and inform you all that our Visions of Community conference is happening very, very soon. Only 2 months left until March 8th. It's a Saturday. It's an all-day event that's happening virtually. So very, very conveniently, just access through a virtual platform. All of the workshops are there. All of the exhibitors are there. You can also win some items. I know that we always have leaderboard contests, which I participate in religiously. I'm always trying to get to the top of that leaderboard, but somebody beats me to it. Maybe this year, who knows? But the registration has already opened today, which is really, really exciting. It'll be here before you know it. And one other thing that is amazing about having a virtual conference is if you miss a workshop, no worries. You have access for the next 3 months, so you can watch every single workshop recorded. And we have language access too, which is just amazing. So now I can exit out of this presentation and we can get to the questions, comments, anything that you want to share with us.
There's one question in the chat around plans for respite assistance for families with adult children over the age of 26.
That's something that we do get asked frequently. And the hope is, of course, that we will be able to expand our program beyond the age of 26. Currently, we are looking for opportunities for further funding, so please stay tuned. As soon as we have any kind of news to share about expansion of the program, our caregivers will be the first to know, of course. So we are actively looking into that possibility.
Right. I think that was the only question
I
relative
see
to
one about the conference. Is the conference open to any family or state specific? Anyone can attend, whether you are in Massachusetts, any other state, and possibly even internationally, as long as you're willing to wake up at 3 in the morning and join our Visions of Community.
yeah.
Yeah, really anyone.
Yeah, and as is noted, if there's anything that's kind of legally referenced, it's going to be Massachusetts specific, but there's so much else that's
Yes.
also shared that's not specific to Massachusetts. So there will be there's something there for everyone. I used to love going to this conference. I still love going to this conference because it's a homecoming. It feels like everybody there gets it. So I strongly encourage you to do that.
And Suzanne is going to join us from Canada. That's wonderful.
Yes.
We look
Awesome.
forward to having you.
Absolutely. Yes.
Yes, registration is on our website. You should see most likely as you first get to the website, there will be a banner that announces the conference. And if you click on it directly, it should bring you to the registration page.
Yeah,
And if you need any assistance with that, you know where to find us.
yeah. And the link to that has also been included in the chat, so you should be able to get to it through there as well. Any other questions? No
I
other
have a
questions?
question. Can I ask it orally?
Of
Sure,
course.
yes.
Thanks. What if you don't feel like you're comfortable right away? I mean, can you just do this caregiver to caregiver as, say, a meetup, a tryout? You know, how does a family who might be hesitant to do this start slowly?
Yeah, it's a great question, because we're all the mama bears are fiercely protective of our children, right? And so it feels kind of strange to be matched up to a stranger. And so, having been someone who just went through this recently, you start out in any way that works for you, right? So it could be you meet for coffee at a neutral place. It could be that you meet in somebody's living room together. You decide what works for you, and then you decide if you decide that you're comfortable with this person, then when would you introduce the child to that person? So I just was matched with someone this past weekend and was able to, there's someone who lives in the same town that I do. And I went over and just hung out with them for about an hour. And the child and I have got along famously well. So we were really excited about that. And it gave us an opportunity to get to know each other. But I think that's also one of the reasons why that introductory call that they set up first, where you meet each other virtually, is really, really helpful, because you kind of get a sense of who that person is, where they are, what they're looking for, and then if you really feel like if something doesn't work, you can say something right then and there. But after that call, you were given the opportunity separately to say, do you think you want to move forward with this? And if you do, then the two of you figure it out together. And that's really what we want to do, is have this be driven by you. We want this to be something you're comfortable with, for you to set the boundaries that you need to set and move at a pace that works for you. And if for some odd reason the match doesn't work, then we can go back to the drawing board, figure out kind of why, and then see whether or not there's another opportunity. Val, would you add anything to that?
No, I think you covered it perfectly well. And I will just maybe add that if for some reason the match does not work out, you just let us know. And we can rematch a caregiver if their current match is not working out for them. And there's also an opportunity to be matched with more than one caregiver. And I think that's really important, because you could have your little social network right there, if you have a match with 2 or 3 caregivers, and it helps in emergency situations especially. And there's
Yeah.
also a question in the chat asking, do people tend to bring their children with them during respite, or does it differ from case to case? I would say that it differs, but we do get that question a lot. And we actually ask our caregivers what their comfort level is when we do the intake call. So we typically will know what each caregiver prefers, so we can let you know when we match you with someone. By the way, this caregiver indicated they would love to have all of your children over with you when you're taking care of their child. And in fact, some actually prefer that because, as I mentioned, the way living on the island works, you don't really have anybody else in your social network, and that includes our children. Our children can also be very isolated. And so I think we take this as an opportunity to also help our children socialize with others, even if they're just doing parallel play, or just in the same room together.
Yeah, I think it's important to kind of remember when people think about respite, because I think we're so used to thinking about someone coming by themselves and providing respite. You can think of this even as a play date, right? That may be a way that works for you as a family. So if in fact you wanted to bring your child and the other person was okay with that, it may actually work well for everybody. So again, it's something that each caregiver kind of works out together to figure out what's the best way.
And also, I think it differs from culture to culture, and that's something that we are still learning and getting a lot of support around from our coordinators, where, we've had in-person coffee chats for our Chinese community, for instance, and that was their comfort level. That's what they wanted to do, meet in person as a group first, and then kind of decide what feels good to them and how they get along with other caregivers. And we've had library events, sensory friendly story time. We've had little mini concerts for our Korean community, for instance, that worked out really, really well and let families meet other families who are in the same situation. So we do try to support each community to and meet them where they are, and kind of just go from there.
As I reflect on my own experience, the families that I met through the medically complex, medically fragile program. So there was a network of families in my region who all had medically complex children. That's how I got to know other families. So I had the advantage of that introduction already. Other families may not necessarily have that or may not have a program like that that's specific to their child's particular support needs. So one of the things I love about Val and her group is they are creating those opportunities for people to have that initial introduction, break the ice, figure out so that when they see a person's name, they know who the heck that is. Because it's perfectly understandable that someone may not be willing to have somebody they've never met before in their home. That makes absolute sense. So we're trying to find ways to make sure it works for people.
Yes, absolutely.
All right. Well, in the absence of any questions, any additional questions, we really do hope that you will take advantage of this program. It is, as I said, near and dear to my heart, having lived what it's like to have that relentless caregiving responsibility that never ends, right? Because even when they're at school, that you're multitasking and trying to get things done because that's the 6 hours that you don't have them under your foot, right? So there's always so many things to do, so many forms to fill out, so many caregivers or um, professionals that you need to follow up on, so many things that need to be done. Everybody deserves to get a break. And so we really want to make sure that people have that opportunity to do that. And while you're considering that, also a reminder that the Visions of Community Conference registration did open today on March 8th. Is that over 40 different workshops will take place. There'll be some amazing guest speakers as well. So please make sure you take advantage of that opportunity. And um, also in connection with that, on March 22nd will be the Vision of Communities Youth Conference, which will take place in person at the Federation's offices in the Schraft building in Boston. So you will see information coming out for that again very soon. That is primarily for transition age youth to come together and to actually learn more about transitioning into adulthood, what kinds of opportunities are there. So there's lots that the Federation has available for families between workshops, amazing staff, many of whom have the lived experience of being a caregiver of a child with special needs. So when you're talking to someone at the Federation, you're talking with people who really get it each and every day. And if they can't answer your question in the moment that you ask it, they will go through heaven and earth to find the answer and get back to you. I can assure you of that. I've always called the Federation your one-stop shopping place for families who have kids with special needs. So know that we're here for you. And I believe that is it for tonight. So thank you so much for joining us. We hope that you will take advantage of the program. And at the very least, that you will remember that the Federation is here for you, and we will do anything that we can to support you as you go along your journey with your child. Have a fantastic night. Stay warm, stay safe, and we'll see you again in February.
Thanks so much, everyone, for being here with us tonight.